You took a pill this morning. You probably did not think twice about it. It took about 10 seconds. You have done it the same way every single morning since your doctor handed you that prescription. And if you are over 60 and that pill is metformin, glipizide, or Januvia, there is a very real chance that something is happening inside your body that nobody properly explained to you on the day you were handed that bottle. Her name was Margaret, 71 years old, retired schoolteacher from Georgia, careful, proud of how diligently she had managed her health into her 70s. On metformin for type 2 diabetes. Not a missed dose in over a year. Her daughter called me on a Wednesday evening. Her voice was tight with worry. Dr. Adam, she has stopped going to her morning walks. She is exhausted by noon every single day and she cannot understand why. Margaret had not had a diabetic crisis. She had simply been living with unexplained fatigue for 4 months, convinced her diabetes was getting worse, quietly reducing her activity because she was afraid of making things worse. That silence almost cost her everything. My name is Dr. Adam. With over 30 years of experience in metabolic and internal medicine, what I am about to share with you are the 9 most important things every senior on these 3 medications needs to understand. Not because your doctor is hiding anything from you, but because a standard appointment gives a physician 12 minutes to explain something that genuinely deserves much longer. Before we go further, drop your age in the comments right now and tell me this. Have you noticed any symptoms since starting your diabetes medication that you quietly wrote off as just getting older? I want to know because what you write is going to matter to someone reading it who thought they were completely alone. If honest, clear guidance is what you have been looking for, subscribe right now. I publish every week for seniors who want real answers about what is actually happening inside their body. Most seniors remember the same experience. A consultation that lasted a few minutes, 2 words across a desk, type 2 diabetes, then a prescription once a day, come back in 3 months. No explanation of what changes inside your cells, no discussion of how a body at 70 responds differently than a body at 45. Just a simple instruction that sounds final. And most people walk away believing something incomplete, that the medication is fixing the problem. The truth is more precise than that. There are 9 things I want to walk you through. The 9th is the most important. Stay with me all the way to the end. What these 3 medications actually are and why they are not the same. Metformin, glipizide, and Januvia all lower blood sugar, but they do it through completely different systems. Those different systems create completely different side effects and completely different warning signs. If you do not understand that, you will misread what your body is telling you. Metformin, the big grenade. Your liver constantly produces glucose even when you have not eaten, releasing it into your bloodstream through a process called hepatic glucose output. In type 2 diabetes, this process runs too high. Metformin works primarily by signaling your liver to reduce that constant background glucose release. Think of your liver as a factory running at full production, even when the warehouse is already full. Metformin tells that factory to slow down, but it does not repair the reason the factory started overproducing in the first place. It manages the output of the system, not the underlying cause. Glipizide, the sulfonylurea. Your pancreas contains beta cells whose job is to release insulin in response to rising blood sugar. In type 2 diabetes, those beta cells have become less responsive, releasing too little insulin too slowly. Glipizide stimulates those beta cells directly, essentially forcing them to release more insulin regardless of what your blood sugar is doing at that moment. Think of it like pressing the insulin release button on demand. The important consequence of that mechanism is that glipizide can push insulin out even when your blood sugar is already low, which creates a risk that metformin and Januvia simply do not carry in the same way. Januvia, the DPP-4 inhibitor. Your gut produces hormones called incretins after meals, which signal your pancreas to release insulin and signal your liver to stop releasing glucose simultaneously. DPP4 is an enzyme that breaks those incretin hormones down quickly, often before they can do their full job. Januvia blocks that enzyme, allowing your natural incretin hormones to stay active longer. Think of it like removing the security guard who was escorting your best workers out of the building before they finished the job. The key difference from glipizide is important. Because Januvia works through your natural hormonal response, it only stimulates insulin when blood sugar is actually rising. This dramatically reduces the risk of driving blood sugar too low, the metformin fatigue, and what it really means. This is the conversation Margaret should have had before she ever stopped her morning walks. Metformin works by activating an enzyme called AMPK inside your cells, which improves how your cells use energy. But in some seniors, particularly those over 65, this mechanism can interfere with how efficiently your mitochondria produce cellular energy under physical demand. That is why you can feel unusually tired, heavy, and drained, even on days when you have slept well and eaten normally. It is not your diabetes getting worse. It is not your heart weakening. It is a predictable metabolic consequence of how this medication interacts with cellular energy production in older adults. What made Margaret's situation dangerous was not the fatigue, it was the silence. She started reducing her physical activity because she was afraid, and reduced activity made her blood sugar harder to control over the following months. Report unusual fatigue. Do not hide it. Reducing your activity out of fear is far more damaging long-term than any medication side effect you have been quietly living with. The glipizide low blood sugar warning you must never ignore. If you are on glipizide, have you ever felt suddenly shaky, sweaty, confused, or unusually anxious between meals or during the night? Not after eating something sweet, not after a heavy meal, but out of nowhere in the middle of an ordinary afternoon or at 3 in the morning. That is hypoglycemia, and with glipizide, it can arrive without clear warning. The critical thing is that it does not always announce itself dramatically. Sometimes it feels like mild dizziness that passes. Sometimes it feels like unusual irritability. Sometimes seniors describe it simply as not feeling right for an hour before it escalates. His name was Robert. 74 years old, 4 months after his glipizide dose was increased, he started having episodes of confusion in the late afternoon that his family attributed to tiredness. He stopped driving because he no longer trusted himself behind the wheel at that time of day. Nobody connected it to his medication timing. When I asked what he typically ate for lunch and what time he took his glipizide, he went completely quiet. Nobody had explained to him that glipizide's peak effect and a light lunch can intersect dangerously. Mild shakiness and confusion reported immediately. But there is one presentation that cannot wait. Severe confusion, inability to wake properly, seizure or loss of consciousness in someone on glipizide. That is emergency care immediately. Glucagon or emergency glucose is needed without delay. Mild symptoms, call your doctor before your next dose. Severe symptoms, move now. The sodium danger hiding in your kitchen, not your medicine cabinet. Think about your kitchen, not your medication cabinet, because one of the most serious and consistently overlooked risks for seniors on metformin or Januvia involves what is sitting in your refrigerator and on your pantry shelf right now. Both medications perform best when your kidneys are functioning well and your fluid balance is stable. When sodium intake is chronically high, your kidneys work harder to manage fluid load, blood pressure rises against that fluid pressure, and the environment these medications work inside becomes significantly less cooperative. But here is the part almost nobody talks about. Processed foods marketed specifically to seniors, low-fat meal replacement shakes, heart-healthy soups, diabetic-friendly snack bars. Every single one of these can contain between 400 and 900 milligrams of sodium per serving, and many seniors eating carefully are consuming 3 to 4 servings of these products daily without realizing the cumulative sodium load they are placing on their kidneys every single day. His name was David, 77 years old, switched entirely to packaged diabetic-friendly meals because he was trying to manage his portions carefully. He was on metformin. Nobody connected those dots. His blood pressure started climbing. His kidney function markers began drifting. David was not careless. The gap was not in his discipline. It was in his information. Read every sodium label on every health-branded product in your kitchen. Ask your doctor, given my diabetes medication and my kidney health, what is my actual safe daily sodium target? The pain reliever in your bathroom cabinet. Check your bathroom cabinet the moment this video ends. Look for ibuprofen or naproxen. If you are taking metformin, especially if your kidney function is anything less than optimal, regular use of these medications can reduce blood flow to your kidneys and increase the risk of a condition called lactic acidosis, a rare but serious complication where metformin accumulates in the body because the kidneys cannot clear it efficiently. Nobody mentions this at appointments because ibuprofen does not feel like a real medicine. It came from a shelf, so it never gets brought up. Ask your pharmacist this exact question. Is it safe for me to use ibuprofen regularly given all the medications I am currently on? That conversation is free. It may prevent a problem nobody saw coming because nobody thought to ask. What happens to your diabetes medication when you get sick? If you are on metformin and you get sick, vomiting, diarrhea, high fever, unable to keep fluids down, the medication that worked perfectly yesterday may behave very differently today. Metformin requires adequate kidney perfusion to be safely cleared from your body. When illness strips fluid balance away, the same dose can now stress your kidneys and, in rare but serious cases, allow metformin to accumulate. The medication did not become dangerous. The body it was working inside changed completely. Her name was Helen. 72 years old, stomach virus, could not keep much down for 2 days. Still took her metformin every morning because she had not missed a dose in 8 months. By the second evening, she felt deeply unwell in a way she could not describe precisely. The problem was not the medication in ordinary circumstances. Her body was dehydrated and her kidneys were under strain. Write this down and put it somewhere you will see it when you are unwell. If I cannot keep fluids down, I call my doctor before I take my diabetes pill. The most dangerous blood sugar reading is not the highest one. The most dangerous blood sugar reading is not the highest number you have ever seen on your meter. It is the one you took at the wrong moment and made a panicked decision from. Blood sugar moves constantly with meals, sleep, stress, physical activity, hydration, and even the anxiety of worrying about what the number will be before you check it. A single reading is not a verdict. It is a snapshot. Her name was Carol, 68 years old. She checked her blood sugar every time she felt anxious, notebook after notebook of numbers, heart full of fear. She was certain her Januvia had stopped working. When we slowed everything down, same time of day, consistent meal timing before checking, proper finger technique, a completely different picture emerged. Her medication was working. The chaos was in the method, not the medicine. Measure at consistent times each day. 2 hours after a consistent meal. Before breakfast after a full night of sleep. React to patterns across a week, not to individual moments. One number is noise, a pattern is information. Only information deserves a decision. The hidden environment your medication works inside every single day. Two patients, same age, same medication, same dose, completely different results. I have seen this across 30 years of practice. The medication is identical. The body it is working inside is not. High refined carbohydrate intake means more glucose flooding a system your medication is already working hard to manage. Poor sleep raises cortisol, which directly raises fasting blood sugar and increases insulin resistance. Chronic dehydration concentrates glucose in the bloodstream and impairs kidney clearance of medications. Inactivity reduces the number of insulin receptors on your muscle cells, making every unit of insulin your body produces less effective. When your medication and your internal environment are aligned, results are stable. When they are not, doses climb, not because the medication is failing, but because the system is working against itself in two directions at once. The best outcomes are never medication alone. They are medication plus the environment it is working inside. The truth almost never said on the day the prescription is written. In 30 years, after thousands of appointments and thousands of prescriptions, the single most important truth about these three medications is the one almost never said on the day the prescription is written. None of these medications erases the condition producing your elevated blood sugar. Metformin reduces how much glucose your liver releases, but it does not repair the insulin resistance that caused your liver to overproduce in the first place. Glipizide stimulates your beta cells to release more insulin, but it does not restore the sensitivity those cells have lost over years. Januvia extends the action of your natural incretin hormones, but it does not rebuild the hormonal signaling that deteriorated over time. All three medications manage the output of the system. They do not erase the system producing that output. This is why follow-up matters more than the first prescription. This is why lifestyle is not optional. This is why a good number on your meter this morning does not mean the conversation is over. The patients I have seen do best are not the ones on the most medications. They are the ones who understood what their medication was doing and what it was not doing, and chose to work with both truths at the same time. The practical framework: if you take metformin, watch for unusual fatigue, especially during physical activity, nausea in the first weeks, and any gastrointestinal discomfort that persists beyond the adjustment period. Never take it during significant illness with fluid loss without calling your doctor first. Avoid regular ibuprofen use without medical guidance. If you take glipizide, keep a fast-acting glucose source with you at all times, a small juice box, glucose tablets, or regular crackers. Eat consistent meals and never skip them on days you have taken your dose. Report any unexplained shakiness, confusion, or afternoon fatigue immediately. If you take Januvia, understand that its lower hypoglycemia risk does not mean zero risk, especially if combined with other diabetes medications. Report any unusual joint pain, as this has been associated with DPP-4 inhibitors in some patients, and alert your doctor immediately to any signs of pancreatitis, severe abdominal pain that radiates to the back. For all three, never use ibuprofen regularly without informing your doctor. Call before your next dose if illness causes significant fluid loss. Measure blood sugar consistently, never reactively. Never stop any diabetes medication suddenly without speaking to your doctor first. Let me tell you what happened to Margaret. After her daughter's call, I reviewed her complete medication timing, her meal schedule, and her daily activity pattern with her directly. I sat with her, not her chart, with her, and explained everything I have just shared with you. She learned why her energy was depleted at the cellular level. She learned it was not her diabetes winning. Within 3 weeks, with a simple adjustment to her dosing timing and meal composition around her walks, her energy returned, her blood sugar numbers stabilized, And Margaret was back on her morning walk every single day. She told me at her follow-up, Dr. Adam, I spent 4 months convinced my body was failing me, and it turned out I just needed someone to explain what was actually happening. 6 months later, she shared what she had learned with 4 women in her church group who were all managing diabetes quietly and alone. 3 went to their doctors with questions they had never known to ask. 2 had medication timing adjustments that were long overdue. 1 had been experiencing afternoon fatigue on glipizide for 6 months, writing it off as just getting older. The information existed, the fix existed. The conversation simply had not happened yet. That is what Dr. Adams' channel exists to do. After 30 years in metabolic medicine, the one thing I know with absolute certainty is this. The seniors who manage their blood sugar best are not the ones on the most medications. They are the ones who understand what is actually happening inside their body and use that understanding to make better decisions every single day. Margaret did not need a different medication. She needed a conversation. Robert did not need to stop driving in fear. He needed one question answered about his meal timing. David did not need to stop eating carefully. He needed to know what was already in his kitchen. Information is not extra. Information is part of the treatment. Now I want to ask you one question. Which of these 3 medications are you currently taking? Metformin, glipizide, or Januvia? Just type the name in the comments. That single answer tells me what matters most to you and what I break down next. And before your next blood sugar reading, carry this question with you. Do I actually understand what my medication is doing inside my body right now and what it is not doing? If the answer is not fully yes, that is not your fault. That is the gap this channel exists to close. I am Dr. Adam. Subscribe so you never miss the guidance your health deserves before the emergency you never saw coming. And I will see you in the next one.